Hi there, my name is Madison Vincent and I am applying for your direct care provider role at your crisis unit located on Buckeye Road. I am graduating from Grand Canyon University. I'll be receiving my bachelor's in behavioral health science, and I have a select interest in the trauma field. I have always had kind of a niche for traumatic events and how they affect people, especially adolescents, and how they develop into their adult lives. I actually have personal experience as well dealing with a few traumatic events in my own life, and so that has helped me be able to really understand the importance of healing, especially in a state where you are still developing as a teenager and still trying to find your identity throughout all the different things that are happening in your life. And so I feel that I would be able to bring a couple different really valuable assets to the team at the crisis intervention unit. The first is that I am super passionate about trauma. I know that sounds kind of crazy, but I love being able to adapt my thinking in ways that will best suit the person coming in and the way that their disorder is uniquely affecting them. Disorders look so different in all different types of people, and there is no one way to treat everybody. Since everyone is unique, you constantly have to be evolving and pursuing more and more knowledge to be able to give the most effective treatment out there possible for these people, because they don't understand exactly what they need when they come in. Especially in a crisis unit, these people are usually in a peak crisis state or having an episode, such as like a bipolar episode. And so that is something where we need to be able to give them the correct information to be able to help them in choosing what kind of healing process they need to go on to be able to kind of get reintroduced back in with new coping skills and all of that. And so I am constantly wanting to pursue more knowledge and be as up to date as possible with all the different types of techniques that I could use in the practice, as well as different de-escalation techniques, since it is so prevalent in this unit specifically to be able to get these patients to a state where they're able to comprehend and listen to all the information that we'll be giving them. Another thing is that I am a more tough individual, which can be a really great asset as well in the crisis intervention unit. I feel that because of the different ways that people can react to a type of episode or anything like that, it is super important to be able to have a tough skin and be able to not take anything personally, especially because these people probably don't even know what they're saying until they're out of the episode and in a clear state of mind. I know that there are many situations where there could be slurs, there could be just really offensive language, or there can be even violence, and that is something that as an employee and as a professional, you can't take super to heart and super seriously in terms of letting it get to you, because they aren't fully in control of themselves. And so it is so important to be able to keep those boundaries and make sure that you are safe mentally and physically, but able to help the patient as much as they need, and be there for them as much as you can. And then the last thing is patience. I feel like I am equipped with a good ear to listen and a slow to speak mindset, based off of the different types of personalities in my family, different friends that I have had in different situations that I have been able to walk through with my super close people. I have learned to just sit and kind of let them explain and just really be able to figure out the best way that I can help them through deductive reasoning, through asking questions, and just making sure that they know that I have their best interests at heart, which I feel like is also the same in a crisis unit. A lot of people come in and they don't feel that they have somebody on their side, and they don't think that you've been through anything that they've been through. And I know that, especially with my trauma events in my past, I can touch people in a different way, and I can reason with them because I do understand where they've been. And I feel like that is such a key aspect in like getting that patience and getting them to kind of open up to different techniques and wanting to heal and all of that stuff, because a lot of people might come in and they aren't looking to heal necessarily. And so I feel like I could really add a great presence within the employees and just for all the patients who come in and all their different struggles. I think that I can be super adaptable, and I am just eager to learn different ways that I can help each individual who comes in with different symptoms, different effects, and different situations, because nobody is the same. And so I am excited to hear from you guys, and I look forward to potentially working with you soon.